All right, well, I want to be respectful of people's time today with the information session, and we have started recording. So I do want to let everyone know that the recording is started for our information session. So we welcome you here today for our clinical rehabilitation and mental health counseling information session. What we'll do is we'll go ahead and get started with the introductions of those who will be presenting today during this presentation. And if you want to keep entering into the chat where you're from, and also you can post any questions you might want answered in the chat. We're happy to see you all here today, and we'll go ahead and get started. So what I'll have our presenters who are going to be going today introduce themselves and hopefully tell you a little bit about themselves. So Dr. Chu, if you're on, you could go ahead and get us started.
Hi, everyone. I'm Dr. Chu. I'm the Director and the Associate Professor of the Clinical Rehabilitation and Mental Health Counseling Program. And thanks for being here. I'm glad to be here to tell you all exciting things about our program. Thanks.
All right, next we can go with Dr. Buckles.
Okay, I'm Dr. Buckles, and I am one of the clinical line faculty here. So I'm an associate professor of instruction and also the director of our addictions and substance abuse graduate and undergraduate programs.
All right, thank you, Dr. Buckles. Next we'll go with Dr. DePippo.
Hi, everyone. Thanks for joining us today. I'm Dr. DePippo. I'm also an associate professor of instruction here in the program. I teach mainly the clinical classes and also oversee all aspects of the field placement process.
All right, thank you, Dr. DePippo. I guess I'll go next. So my name is Greg Wantz. I am the Academic Services Administrator here for the Clinical Rehabilitation and Mental Health Counseling Program, and I'll pass it on to Tatiana.
Hello, my name's Tatiana Acosta, and I'm the Academic Program Specialist for the Clinical Rehabilitation Mental Health Counseling Program. It's good to see all of you today.
And last but not least, we have one of our student mentors and one of the students that is currently in our program. So Kelly, you go ahead and introduce yourself.
Hi, my name is Kelly. Like Greg said, I am a student in the program. I just entered my second year, and I'm currently on the MFT track, but I'm also a GA for the program, so I've worked pretty closely with Tatiana and Greg and a lot of the faculty, so I'm excited to see you all today.
All right, thank you all. So we'll go ahead and move on to our next slide. So this is just a agenda of what we'll go over today. So we'll go over our program mission and highlights. We'll go over the potential careers you could get with our graduate degrees from this program. We'll break down the academics and the field placement. I know that many of you had questions about how does field placement work and what does the program look like. So we'll break that down. We'll also break down licensure. Talk a little bit about the student experience here in our program, of course, the application process and tuition and scholarships, and then we'll finish off with a Q&A. So I will let Dr. Chu start off by talking a little bit about our mission and our program.
Thank you, Greg. So first of all, I just want to say that we want this information session to be like interactive. So if you have any question, probably type in the chat, so we will answer that later, or you can ask us questions at the end, right, during the Q&A. I will probably bounce back between faculties and Kelly to talk about their perspectives. So I'd like to provide some highlight about the program. I feel our program is like very, very different than the traditional clinical mental health counseling program, and that's one of our strengths. And you can see that from our mission statement. So we are not only working with people who have mental health issues or behavioral health concerns, we are using the holistic approach. We want to work with everybody, and especially people who have disabilities. So a lot of mental health counselors working with people and with behavioral health issues, and a lot of people not only that they may have disabilities, and with their mental health issue is possibly will impact their health, and there will be like chronic illness issues, substance abuse issue, and other different type of like how their conditions impact their quality of life and their contribution to their the society. So we are not only trained people to work just looking at a diagnosis, treatment. We are embracing the holistic idea. So the mission of this program is to promote quality behavioral health care for all, particularly people with disabilities. And for starting this year, we have a required track selection, so people can either become a certified rehab counselors if you are interested in working with people with disabilities, or licensed mental health counselors if you want to work with the behavioral health issues. So next page, please. So these are just like some highlights about our program. Like within this hour, you probably won't know like everything about our program, but you will get to know us. First of all, we are nice people. So our program is big enough, so we offer a variety of classes, but we are small enough. So we kind of trying to get to know everybody. So you will have an advisor, you will get to know all the faculty, and we offer a cohort model. So you will get to know your cohort as well. And you can see from our title, this is a clinical program. We kind of call it a terminal degree, which means that after you graduate from the program, you are ready to practice in the field, right? But with the licensure requirement, you probably need to take longer to be licensed, but you can start practice under the supervision. So in our program, you get to go on the field placement. Then later, Dr. DePeppo will talk to you more detail about that. And our faculty are amazing, right? Like, I know you're probably laughing, but our faculties are researchers, they are clinicians. A lot of our clinical faculties practice on the side, so you learn from firsthand experience. And some of our faculty also hold a national office in a professional organization. So you will get to explore, expose to different type of opportunities, going to conferences, become a student representatives, and or in lots of like professional organizations. So it really depends on your interest, and we really encourage you to talk to our faculty. And our program, later we will talk about that a little bit, but our program currently are accredited by KCRED because there's no longer core. So once you graduate from the program, if you are in rehabilitation counseling track, after you finish 75% of your coursework, you will be eligible for CRC. If you are interested in become licensed, Dr. DePeppo will also talk about that later, but you will fulfill all the course requirement and the field placement hours required for licensure in Florida. There are different requirements in other states. So if you plan to move to other states, you have to start from the beginning to look for what's the requirement, what's the hours required to become licensed. But I can tell you Florida is kind of one of the like more restricted states. So we tend to have more additional requirement to become licensed. So a lot of most of the states, if you are eligible here, you should be eligible in other states. And I also want to highlight that because this is a clinical program, we let our students go to the community to do their field placement. And last year, we just celebrate, is it this year? We just celebrate our 50th anniversary. So you can tell a lot of our site supervisors are our graduates. So when students are doing their practicum internship, they are learning from the community. They can choose where they want to go. So you can really explore and look for things that you are really interested. Next page, please. Dr.
Yes, I think I'll start it off. Okay, so you guys, okay, perfect. All right, so in terms of careers, right, as Dr. Chu was mentioning, if you choose the mental health counseling track, you would be eligible to become a licensed mental health counselor in the state of Florida. And what that credential and that license means is that you would be able to work with individuals of all ages. You're also able to work with couples and families. Individuals run group counseling sessions. So it really opens the door to a variety of possibilities for you to match your skill set with the population that you're wanting to work with. Another option, and many of our students over time might want to pursue private practice. So you could also open up your own business, right? Run your own private practice, be your own boss over time. And then certainly many of our students and graduates work in the public, for-profit, and also nonprofit agencies. In the earlier, I think it was the slide before this, the good news is our students, they get hired on. It's a beautiful thing. We have a great reputation in the community, and many of our students, in fact, even get hired on before they even graduate at placement. So there's a lot available to you in terms of career paths.
I was muted, sorry. The other career paths, we talked about the 2 tracks. So there's the mental health counseling, which leads towards licensure. And then there's the rehabilitation counseling track that you can choose from, which leads to a national certification, which is a certified rehabilitation counselor. So that's recognized nationally and is not different from state to state. As a CRC, you could work in vocational rehabilitation facilities, federal agencies. So VR has a voc rehab department as well, state agencies doing vocational experts, forensic, there's forensic work and court work you can get into under, being a rehabilitation counselor. So there's a lot of opportunities when you're focusing on individuals with disabilities and looking at the impact that disability might have on their functioning and then employment. The other is the MCAP, which is a Master Certified Addictions Professional. That's specific to the state of Florida, but every state has some level of a substance abuse credential. So again, kind of like Dr. Chute said earlier, if you're looking at practicing in another state and you're interested in that, then you would definitely want to see what that state's requirements are. But for MCAP in our state, basically, it's a credential that says you're an expert in working with people with disabilities, with substance use issues. And so you're trained it requires having specific training. So that's why we have the graduate certificate that is an option you can choose inside the program to focus on working with substance use issues, because that gives you the content specific training that the state requires. To get this credential. And then you will be basically, once you take the test and you go through the process, there's some experiential hours very similar to licensure. Then you'll have that credential which sets you apart and really says that you specialize in working with individuals with substance use issues. And it's really important in substance if you have any interest in working in the field, because it is so prevalent that in many settings you're going to come across individuals with substance use issues. So these are some of the career opportunities, and there are a plethora of other settings and areas you can work in as well that you'll learn throughout the program.
So I think before I start, I forgot to ask your opinion, guys, like Dr. DiPeppo, Kelly, and Dr. Bacchus, can you share with the group that what is the most highlighting that you would say about our program? We're supposed to make this interactive, so I forgot to ask that question. Dr. Bacchus, what would you say? Why do you think students should choose our program?
So a couple reasons, and one is very much on my area. So we are a program that's unique because we do have a focus in substance use. A lot of programs you only take one course, which is required by the state, and that's kind of just a general overview information. But if you really are interested in working with substance use, we do have that specialty along with, training in MFT as well. So both areas to be able to kind of specialize. And then I think beyond that would be just the support and faculty and collaboration amongst our cohort. We serve as our advisees for the students. So you have a lot of contact and we're here to support you, kind of open door policy. And so we really want students to succeed, and that's our goal as faculty.
I very much agree with what Dr. Buckle said. I also want to reiterate her point about how there's so many different opportunities for specialization and kind of figuring out like what area you want to do as a student. Obviously, all the faculty encourage you, even post-grad, to kind of explore and look for that population or that area that might fit with your career goals. But I think within the program, they give you a lot of room to explore different things.
And I would also add, we touched on this a little bit, but the relationship you develop with the faculty, since we are your advisors, that sets us apart from other graduate programs. And also, I would say just our reputation within the community. I mentioned our students, they get hired. I can't tell you how many times I have sites reaching out to me specifically like, hey, can you send me a student? We really value how you train your students, and that they sometimes prefer our training model and things of that nature. So I think the reputation in the community is another really cool thing about our program.
Great, thank you. So you can probably see for what they tell us that one of the highlights, the difference about our programs, that we offer a lot of different choices. So you can see from this slide that students coming to the program, they will need to select either mental health track or rehab counseling track. For students who are in the CRC track, they have options to actually apply to become an RSA Scholar program. The RSA is actually a federal grant training rehabilitation counselors working in the public agencies. So if you are in this track, you need to take 3 additional courses, but it's within your plan of study. So instead of graduate with 60 credits, you will graduate with 63 credits. So it's three credits additional to the general track. So, and then on the top of the required track, if you are interested in substance abuse, you can see the LMHC or CRC track plus the MCAP program. So it's the same thing, the ACS certificate. Dr. Buckles will tell you more detail, but you will also graduate with 63 credits. And we also have an MFT certificate. So same thing, there are 5 classes. Some of them are already in your plan of study. So you will also graduate with 63 credits. And on the all top of this, if you say, I am actually a researcher and I'm very interested in going further schooling to apply for doctoral degree, then you can actually elect to do thesis. It's a different track. We don't normally recommend you do certificate plus thesis because it's quite time consuming. But if you are interested, contact us. We can tell you more about the thesis track. Next page, please. So we offer full-time and part-time plans. So you can see for full-time, it takes 3 to 4 class. It will take 3 to 4 classes per semester, including fall, spring, and summer. So if you take all the required classes, you will be graduate in 2 years. So there will be 6 semesters plus 1 more semester. And during your last semester, the only thing you do is your internship. And your internship is like a full-time job. Dr. DePepper will tell you more about that, but you're required to do 40 hours a week of internship. And if you are part-time, it takes 1 more year, and we kind of lay out that for students who are in part-time track, they typically take 2 classes per semester. Next page, please. Yeah, so I mentioned in our program, the total program by CACREP accreditation, you have to have 60 credits hours to be eligible to say I graduate from a CACREP accredited program. In our program, you will have 42 core credit hours. It's equivalent to, let's say 13 or 14 classes, and you have the 6 credits is two classes that you can use that to take any elective classes that we offer. So if you are interested in, if you are a certificate student, typically you will use those 6 credits to take your specialty class. But if you are in general track, you say, I'm not interested in any of the certificate, but I'm interested in all of them in general, you can just pick 2 classes from any certificate program. Then for our field placement is 12 credits. So you will have practicum 2, and then internship. So for practicum 2 is 3 credit hours. Practicum 2 is also 3 credit hours, and the internship is 6 credit hours. That's why it's a 40 hours internship. And if you, like I already told you, if you are in a certificate program, later you will see, but you will actually graduate with 63 instead of 60 credit hours. And this is what it looks like for the mental health track, full-time student. So you can see, usually you take 3 to 4 classes. So next slide, please. So this is pretty much the same. So the different track only have 2 different classes in the first spring. So if you are interested in both track, it's possible, then you will use elective again to take additional 2 classes during your other spring. Next page, please. I think this is Dr. Buckles.
Yeah, so this is what the plan of study would look like for the ASA certificate. So as Dr. Chu mentioned earlier, the substance abuse certificate is 15 credits. It is actually offered all online. So all of the, or most of the courses, I'll tell you which ones, the only one that isn't is practicum, are offered online. And this is how it fits within the plan of study. So with both certificates, the way we work them with our students is that 2 of the classes are a part of the general track. So that's your practicum and fundamentals of substance abuse. Everybody takes those courses. And then 2 of those classes would then fill in your elective options. And then you would have 1 additional class, which would be the 3rd class. So specifically for the addiction certificate, we focus on professional skills, legislation, kind of learning how it is the state of Florida, but the state of Florida governs substance abuse treatment because it is very different than mental health, and how it's managed and licensed. We look at specifically counseling approaches and theories regarding focusing on how it views substance use disorders and addictions. We're not only talking about, substances, we're looking at behavioral addictions as well, eating disorders and other things like that. So addiction as a broad category. And then addictions treatment with special populations is the final option that is a part of the certificate. So basically it fits well within your plan of study, and you'll be able to kind of wrap that out, and then you'll get the certificate once you've completed those 5 classes. And I mentioned earlier that these classes provide you the content specific training that you would need if you were interested in going for state level certification. Dr. Chu, do you want me to just continue?
Yes, please. Thank you.
Okay. So this is the MFT certificate. So as you can see, it's pretty much you're doing the same kinds of things. So with this one, your electives are worked in. So if you're doing this, you will take and you start your MFT certificate electives on in the first summer. That's the same with the substance abuse certificates. You would have your first certificate class, which is fundamentals of substance abuse in that first summer, and then it carries out through the next semesters. With the MFT certificate, you have some options of choices with your classes. So when you're working, if you do choose MFT track, you'll work with your advisor, or when you do your plan of study, to determine which elective classes you are wanting to take. So those are listed within the plan of study, so you'll know what's offered in each semester as an option. So with MFT, you have human sexuality and counseling, and your trauma class are going to both be considered as part of the certificate program, and then you take those 3 other electives. So it works very similar to the ASA certificate as far as then you graduate with 63 credits, and you're basically choosing your electives from the MFT concentration. Now, the MFT certificate basically allows you to say that you have a specialty or a training. It's just giving you knowledge in working with couples and families. So if that's something that you are interested in under your license, because as we mentioned earlier, in what licensure gives you practicing rights to, you can work with couples and families. And so if you think that's something that you're interested in and you want the knowledge to be able to work with that population, then the MFT certificate would help you gain knowledge in that specialty.
Okay, hi again. So field placement, this is a very exciting part of your time in the program. And as Dr. Chu mentioned, you will have 3 field placement opportunities. We have Practicum 1, Practicum 2. Both classes are 3 credits each. And then the final class you take in our program is internship, which is 6 credit hours. We have over 100 field placement sites in the community that we have partnered with. So we have a database, we call it IPT. And that's where all of our placement sites are listed. And so you as a student get to really look at that list starting the first semester of the program and familiarize yourself with the agencies that interest you and the ones that are, you know, close in proximity to you. We have placements definitely in Tampa, but we also have in St. Pete, Sarasota, north of here in Newport Richey, Wesley Chapel area. So we cover a wide range within the Tampa Bay community. Each spring, I host what's called a field placement fair, where we invite our community partners to host a table and share with our students about what they offer, what their agency is all about, the clientele that they work with. And students can also pass along their resumes and really try to sort through what placement they feel like they would be a best fit at. Again, many of our students get hired on an internship, so that's always a possibility. Next slide, please. Okay, so let's break it down a little bit further in terms of the hour requirement. So I mentioned that we have Practicum 1, 2, and internship, and there's specific hour requirements needed for each of these classes. So when you enter Practicum 1, and actually Practicum 1 and Practicum 2 are the exact same in terms of hours, you need to complete a total of 150 hours over the span of the semester. So that breaks down to where you're at your agency 10 hours per week during the spring or fall semesters, and 15 hours during the summer, because it's only a 10-week summer semester. It's more condensed during the summer. So you attend the class, I'm sorry, you're in the community for those hours, and you also attend a class. That's where you get your group supervision. You get to learn about really specific things related to doing counseling and all of that. And then finally, as I mentioned, the last course in the program is your internship. And this is a biggie. This is, it's required to obtain 600 hours over the span of the semester. And that breaks down to where you're at your site for 40 hours per week. That's for spring or fall. We do not offer internship during the summer. As you can imagine, that'd make you work in a 10-week semester, a crazy amount of hours. So our cohort model has our students graduating and taking this class either in the fall or spring. And really, field placement is all about really taking what you're learning in the classroom and applying it in a real world setting. Next slide, please. Okay, so the hours that I just covered are hours that you would take within our program. And these hours are what makes you eligible to become licensed in the state of Florida. Now, when you graduate, you are not licensed, okay? There's still steps to take, and that's what I'm going to talk about here. So the hours in the program make you eligible, right? Once you graduate, what you would do is then you're going to register with the state of Florida to become what's called a registered intern in the state of Florida. And this is where you've graduated, you're working full-time somewhere, you're getting paid, all of that good stuff. And once you're registered with the state of Florida, you are required to obtain 1,500 hours of direct clinical contact with clients. And so you're in those 2 years, you're collecting hours, and that's what it takes is 2 years to get fully licensed. So you're working, accruing those hours. You're also being supervised by what's called a qualified supervisor within the state of Florida. Once you've obtained your hours, it's also required too to pass a state exam. And at that point, you can become licensed. So it is a process still after graduation. And the process is at least 2 years, right? There's no shortcutting it to work like, a ton of hours and get all your direct client contact in a short amount of time. The state requires it to be at least 2 years, but no more than 5 years for this process. Okay, next slide, please.
All right, thank you, Dr. DePippo. I'll take over from here. So what I want to talk to you all about right now is the student experience. So with the student experience, we want to talk about some of the things that we do offer here at USF to make sure that you're successful and you're also involved during the clinical rehabilitation and mental health counseling program. I'm going to have Kelly probably join me and talk a little bit about her experiences because she's going through it. She's in her second year now. But we have a couple opportunities here. So one of them is known as iLink, and this is our graduate student organization for our CRMHC students, and they get involved in different events throughout the year. So these could be professional building, it could be teamwork, but essentially what they're doing is they're involving the cohort because we do operate on a cohort style model. So you have quite a few other students who are doing the same exact stuff that you're doing in our program. We do also have a robust student mentorship program where we pair some incoming students with students who have been in their shoes maybe a year or two before. Kelly's actually one of our student mentors and has a small group of students that she helps with. Like I said before, our program operates on that cohort model. So the cohort model is roughly those 40 or 50 students who are in this program with you will be taking the same courses, doing the same times when they do like their practicum and internships. So you can really rely on each other and help each other out. And they are very small classes. So usually most of our classes don't exceed that 20 to 25 student mark. So they are very small. You'll get to know your faculty really well, and you'll build that community with each other as you progress through this program. We do have a variety of skill building events as well to help you prepare to be successful at USF and beyond, which includes that field placement fair that Dr. DePippo talked about, and also some other things getting you ready to enter that workforce after you graduate. So Kelly, would you like to add anything about your experience so far?
Yeah, I was just gonna say that I think in the past year or so, we've really taken an initiative to kind of have the cohorts intermingle and also have like kind of a connection with the MFT program as well. Like this year, we did orientation with them, so that way we're really trying to have that interaction, that connection amongst your peers, because as your professors will tell you, this will be your professional network once you move into the professional field. So building this connection now with your peers and your professors is super important, and also just important to have that support. Like going through grad school can be very tough. So having things like the peer mentorship is really nice to have, some guidance and to have somebody like to bounce off your ideas and stuff like that is just really beneficial. So hopefully, whenever your cohort comes in, you will have the same experience. You will have peer mentors that you can reach out to that can help you with things like homework or something. And just having that support network is really important within the program.
All right, thank you, Kelly. So I'll move on to the next slide. So I know that a lot of you have questions about how to apply for the USF Graduate School and what would be the next steps from here. So you've learned a little bit more about our program. So the first step would just be doing the general USF graduate school application. So you could find this on our website. So if you went to the usf.edu/RMHC, then what you could do is underneath there, you'll find our admissions tab, and our admissions tab will take you to that apply now button. So once you do the apply now, it'll go straight to the Office of Graduate Studies. That's where you can create your profile and apply. So if you're really looking into applying to almost any graduate program here at USF, this would be the first step you'd have to go to, not only just for the clinical rehabilitation and mental health counseling, but also for our other programs that we offer as well. So Kelly, you're probably not too far removed from this. How easy of an experience is it?
Something that I found in my graduate program search was that I do think that this application process was like somewhat easy and just there was a lot more information accessible. We try to do things like this to make sure that you have all the information that you need. So, always you can reach out to me, Tatiana, or Greg, or even Dr. Chu or the faculty if you have any questions. We want you to make sure that you have all of the information accessible to you about the program and about the application. I think that the application process is fairly easy in the sense that, once you make that application portal, you pretty much just upload things as you want before the deadline, and they should be there for us to look at. If you have any questions about things being uploaded correctly, especially like recommendation letters, you can always email one of us and be like, "Hey, can you check my application portal?" And we can check and make sure that things are there. We can see them, just so when that deadline comes, everything will be sorted and clear for everybody.
I think that's a perfect segue, Kelly, going on to our next point. So this was talking more about just the general USF graduate school application, but now let's talk a little bit more about what the actual CRMHC program application looks like. And the first step here, which is that submit a complete application, is the one I was just talking about. So potentially what you'll do is through that the USF graduate school application portal, you'll upload your resume, you'll upload a personal statement. So your personal statement's usually a 1 or 2 page statement about your interest in this type of program and what you hope to get out of it, or your underlying reasons behind why you want to pursue a graduate program in this area. What we do want is 3 letters of recommendation. It is highly recommended that one of those is from an academic source, but if you've been outside of the field of academia for a while, maybe you've been working, some great sources of letters of recommendation can be from your current employers or people who could speak to your ability to learn new material. So that's who we usually recommend getting those letters from, and you can have the professors send them to you directly. I believe you'll be the one who will have to upload that to your profile. So if you have digital copies or paper copies that you could scan, you could then upload them to the profile for the application. We do, potentially the graduate school was looking for GRE scores. And usually with GRE scores, we're looking just for the general GRE. So no, I get a lot of questions where it's like, do you want a specialized GRE exam? And what we're looking for mostly is just the general GRE. So that is based upon your scores in the verbal section and the mathematical or quantitative reasoning section. And on average, usually what we see is a score of around 300 would be sufficient. So they score each area separately. And if you get a score of like 150 in one and 150 in another, that's fine. If it's like 160 in one and 140 in another, that's also perfectly fine as well. But usually that average GRE score is around that 300 mark. And then another thing that we take a look at is your undergraduate transcripts. Now, if you are a USF student for your undergrad, the good news is we already have your transcripts in our system, so you wouldn't have to send them again. if you're already here at USF. But if you've taken any college courses for your undergrad outside of USF, then you would want to make sure you send those in so that way we have all of your information. Two things that we're really looking for is making sure that you have above a 3.0 GPA on your undergraduate coursework. And the one big thing that we do want to stress is it just has to be a bachelor's degree. It does not matter which major you've pursued. So the big thing there is, usually we see a lot of our students come from a psychology background, but that doesn't necessarily have to be the truth. If you really have a passion for this and you want to go on into this grad program, you will be able to do so with a bachelor's degree. And the other thing that we really want students to have is an undergraduate level statistics course. This comes in handy, especially when you're building upon that foundation for research and learning more about assessment. So it would be any undergraduate level statistics. I know the common ones that we use here at the university are like introductory statistics or social science statistics. Those should be sufficient for that statistics requirement. There is an accountability background and drug screen forms that are part of the application process with the university. So you will fill those out. And there is a small application fee that goes along with the university's grad school application. The next step after that is then we will look at our applications and we will set up the interviews with selected applicants. So the priority deadline, and I want to stress this, the priority deadline would be January 15th. So January 15th is when you would want to try to have your application in with all of your application materials. That is our priority deadline. So students who get it in before that January 15th deadline, they will be considered. There's no guarantee that if you get it in after the January 15th deadline that we'll have enough open spots remaining. So I really want to stress, you want to get it in before that January 15th deadline. We will set up the interviews with you. So that way you can do your interview with our faculty for the program. And then based upon your application, letters of recommendation, your scores, and your interview, that's when they'll make their decisions. So when decisions are made, we will send out that information and email notifications. Some will be immediate, others might be later on in the spring, but just know that it takes a little while after the interviews happen for the faculty to make their decisions for the program. So you may hear back quickly, you may take a little while, but either way, you will get a response from us. So I saw quite a few questions in the chat that have been popping up, looking at like, well, what's the acceptance rate or, what's the best scores that we've seen. So this is based upon what we saw for last year. So with our students, we had about 140 to 150 applications that came through that were interested in the clinical rehabilitation and mental health counseling program. And we had about 37 students attend our program. So that seems like a pretty big number jump, but when you take into the account that some students decided to go to another graduate program, and that some students weren't able to attend and start our program, usually on any given year, we have about 40 to 50 spots available. That's what we're hoping for this next year for our CRMHC program. So if you apply and want to be part of one of those spots, our acceptance rates vary from year to year, but it really depends upon the number of the number of applications and also the quality of our applicant pool. So you want to make sure that you have everything there to put you in the best light. And then, like I said before, January 15th is our priority deadline. So we highly recommend you get everything in before that date. And if you want to request a welcome packet or any additional information, you have that link right there at the bottom, and that'll go straight to our program assistant email, which will be answered by either myself or Tatiana usually. And I noticed a lot of questions in the chat about this factor as well, which is tuition and scholarship information. So there are a variety of scholarships out there that you could take advantage of, and we'll post a lot of them on our website. The university also has a pretty robust scholarship portal that you could go into and that you could also access to try to see if you could pay for graduate school that way. I'll have Dr. Chu come back on briefly if Dr. Chu wants to talk about the RSA scholarship and the BWET scholarship.
Okay, yeah, so in our program, like I mentioned earlier, we have RSA training grant, and it's for people who wants to become a rehab counselor. So the grant itself, for each scholar will receive like approximately $24,000, and you will get a paycheck. For every semester you receive the paycheck, you will have 1 year of payback obligation by working in the public agency as a rehab counselor. So there's a huge demand in the field. I just talked to the rehab agency in state of New York. Their starting payment is like $80,000, like their starting salary. So if you are interested in that, you have to apply to the program, and then the deadline is usually after you come to the program. So you can start be in the scholar program the second semester. So just contact me, then we can talk in more detail. But it's a different type of career. So if you are really interested, you really need to go online and look at the RSA scholarship program and get more information. Then we also have a HRSA grant. The BWET grant is actually for people who are interested in integrated behavioral health. So there's a trend, the national trend to place mental health counselors into the primary care settings. So if you are interested in working in hospitals, clinics, working with primary care physicians, then you will want to apply to this program. This program provides a $10,000 stipend with no payback obligation, but you can only be eligible during your field placement semesters. So you will get 2 payment of $5,000 when you are registered for your practicum 2 and your internship. So that's what we have currently in our program. Thank you, Greg.
All right, thank you, Dr. Chu. I do want to talk about a few other things. So employee benefits. So if you were employed by an agency or if you're employed here at the university system, potentially they could also help pay for tuition and fees and books for the program. So if you're interested in learning more about that opportunity, I would say just check with your employer. We do allow for like the state benefits. I know like I took advantage of that opportunity a little bit here working at USF, where there's the state employees, although you might have to do it part-time instead of the full-time as far as the schedule, but those are some other opportunities as far as funding this graduate program as well. I do want to talk a little bit about, we do have some students out there who acquire what is known as a graduate assistantship or teaching assistantship, and those are through the university. And it's almost kind of like a part-time job that students do in order to get what's called a tuition waiver. So if you find yourself wanting to see if you can acquire one of these positions, I'd highly recommend checking out our careers website and seeing if there's any open graduate assistantship or teaching assistantship positions open. Most of them will be through areas like the counseling center, the honors college. We don't have any direct through our college here, but there are some available at the university. We do also sometimes have something called student assistantships, where students can potentially work a part-time hourly job to help out with some of our classes here at USF. So if you're looking to have another experience that would help make you some money to help defray some of these costs, you also have those opportunities as well. And of course, the one thing that many graduate students don't think of, but graduate students, if you are a US citizen, you can apply for the free application for financial student aid, also known as FAFSA. Some of you may have done that during your undergrad where you applied, and that is the federal United States government organization that helps connect you with scholarships and grants. So I'd highly recommend filling out the FAFSA. Even if you're like, I'm not sure if I'm really going to get anything, I'd highly recommend it because that is your source to all of that different information. I did put some of the numbers down there at the bottom. So really tuition and fees depends on your classification as in-state or out-of-state. Right now, our in-state tuition and fees per credit hour is right around $431, and the out-of-state per credit hour is about $877. What we see consistently is that these rates are pretty competitive around the state of Florida, and Florida continues to be one of those states where it's actually a little bit cheaper to come out of state. From my experiences, I actually came as an out-of-state student for my undergrad here to a Florida institution, and it was actually cheaper to come to USF from out of state versus trying to stay in my home state and try to get the same kind of degree. So it is, again, kind of a shock to see like the prices of the education, everything, but there are different ways that we try to get our students connected with the scholarship and tuition information that they can in order to pay for the program. And as you can see there in our image, we do sometimes offer scholarship boot camps, so that way our students can then apply for some of those scholarships that are out there. So at this time, we'll kind of go through the chat. I see that Kelly's been helping us answer some of these questions. Thank you, Kelly. But we'll go through and see if there were any other questions. So if you have a question, just feel free to put it in the chat. And we thank you for joining us today. And we hope that you learned a little bit more information about our program. So I see some different questions in here. I noticed there was a lot of questions about the GRE waiver. So potentially with the GRE waiver, it kind of goes along with experience. Usually that's the one thing with the GRE waiver as far as getting one of those. So you could always ask us those questions as well. You will have an advisor that specializes in the program. So with Dr. Chu, did you want to add something about that?
Oh, no, I'm just saying, like, if we are unable to answer the question, maybe people can just like turn on their speaker and ask questions. We have probably like 5 minutes. Do you have any like questions that you think you like to be answered right now? Rather than typing.
Dr. Chu, there's something that I see to be good to address, which is the question of us versus MFT.
Okay, so but I see questions. So Dr. Bach, do you want to just like briefly share about that?
Yeah. So basically what I would say is it's your professional identity. So the two programs train differently. MFT is a different philosophy. They're system oriented in their approach. They're system oriented in how they perceive problems. It's not as diagnosis and mental health heavy. So your classes are going to be different in that program. So you have to ask yourself as a professional, how do you want to be identified? So if you're interested in working with individuals with mental health issues, you could still work with families and couples, but your approach, your philosophy, and your training from your counseling theories perspective is going to be grounded in more of understanding kind of the holistic individual and looking at how those issues or other types of things, depending upon your theoretical orientation, create presenting issues. So at the end of the day, it's really asking yourself, what do you want to be known as? If you just say, I want to do individuals and I want to do families and I want to do couples, then maybe mental health is your kind of approach and you want to just do training and marriage and family therapy. But if you say that I believe that relations are the core of all problems, then your identity may be more in an MFT realm, and that training would be more suited, in the philosophy that you're aligning with.
I think you're on mute, Dr. Chu.
Thank you. Thank you so much. Yeah, I see. I have hands up here. I have Courtney, Ty, and Sam. I know Courtney, you kind of put your hands down. Do you still have a question?
Yes. Hi. Good afternoon. This might be a little bit off topic, but I had a question. The master's rehabilitation and counseling program with the science disabilities online program. is that still similar to the, is it similar to the rehabilitation and mental health counseling, but just strictly more the rehabilitation side?
It's a very good question, Courtney. Yes, yeah. So the fully online master program in rehabilitation, counseling, and disability sciences is focusing on people who are interested in working with disabilities and advocacy. So if you are interested in become a CRC only, then it's a program for you.
Thank you very much. Okay.
Yeah, okay. And then the online program actually accept admissions fall and spring, both semesters. Okay, next, Ty. Is it Ty? I hope so.
Hi, yes, it's Ty. I have this question in the chat, but I'm currently torn between an MSW and the mental health rehabilitation counseling program. I've heard different opinions on maybe the MSW is more versatile and that more federal agencies prefer to hire from an MSW. And I just wanted to get your opinions on that, the pros and cons of both.
Chi, you're on mute. Dr. Chu, you're on mute.
Sorry, I think this is a great question, but this is kind of like 2 hours question. So we can talk about like we all operate under the different philosophy and different approach and different focus. But in terms of career, they overlap with each other, and it depends on the agencies where you are eligible to work. So if you are really interested, can you contact me by email and we can chat? Just like not this time.
Okay, thank you so much.
It's a good question though. Okay, Tatiana.
Hello, can you hear me?
Yes.
Hello, Dr. Chu. I just have a question. If I'm on track to graduate my bachelor's in spring of 2025, should I apply to be accepted in the 2025 cohort?
Sorry, you're muted again, Dr. Chu.
Yeah. Sorry, I didn't quite understand your question. So you are graduating in the spring of 2024?
Yes, 2025. Yeah.
2025 or 2024?
2025.
So you are a junior right now?
Yes.
Oh, okay. Yeah. So I don't quite get, yes, you can be admitted, you can apply for the fall of 2025. Yes. So you don't need to be graduated to apply. So as long as you graduate before you come to the program, that will be okay.
Okay, thank you.
No problem. Sam?
Hey, good afternoon. I had a quick question. So I'm a full-time hospitality worker. I'm a server. I work like 40 hours a week. And when we were talking about the internship hours, how would the program be flexible when it comes to scheduling those internship hours and other cohort hours when it comes to our like jobs?
I will let Dr. DePepo answer this question.
Great question. It really, there's some flexibility based on your agency's offerings. Like sometimes an agency might have nights and weekends available to you, or during the daytime, depending on what your need is. But with that last semester, the 40 hours, it makes it very hard to work much else, right? Anywhere else. So you have about 2 years and for that particular semester, whether it's saving up, how you want to pay for it. Some of our students try to get hired on, get their foot in the door at an agency so that they can be paid as an employee and also use that employment as their field placement site, which we do allow if on a case-by-case basis, right? I would have to meet with the employment site, make sure that they can meet our requirements. But it is possible to use your employment, as long as it's in the counseling field and I approve it, as your field placement site. So that's kind of one workaround, but there isn't a ton of flexibility in terms of doing it across multiple semesters or anything like that. So we really stress that particular semester, it's a K-CREP requirement. And that's one of the things that makes you eligible for licensure. So there's a little flexibility, but not a ton.
Thank you so much.
Thank you. So I know it's 1 o'clock, so if you need to leave, we understand. But if you have more questions, we will stay here for 5 more minutes. I see, help me here, my art grow.
Yes, do you hear me?
Yes.
I just want to clarify what she said. We can use the place we work as a practicum. I work at the White Sands Rehab Treatment Center, and obviously it's a substance abuse place. So I was wondering if I could do my internship there, since I'm already working.
So there's a high likelihood. We do have a partnership with them. They're one of our field placement sites. We haven't had a student there in a while, though. So the process would be, if you were to get into the program, we would connect. I would learn more about your roles and responsibilities within the organization, make sure that they can support our requirements and really the training that we're looking for. So if those things are met, then yes, absolutely. So agencies such as White Sands, that's pretty common for us to approve.
Thank you.
Any other questions? No, okay, great. Thank you so much. So we will send out the recording. And if you have any questions, feel free to contact us. So thank you so much. We are looking forward to see your application.
Yep, thank you all for attending today. And we will send out this recording to you all.